Okay, so we're going to be going over the psoas, iliacus, also all the sorts of things that can be tied into lower cross syndrome. I know that you have scoliosis, you told me, so we'll be mindful of that as well. Okay, so this is not super duper hardcore, which is great for you, because obviously there's levels to that. But I can see where there's a kind of a bit of a hip shift to the right. Is that how you experience it? You're feeling it in your back, higher up on the left. Mm-hmm. So that is consistent. So because it's kind of like a shift here and a shift here. So I don't know if you guys can see that from here, but that's the
mm-hmm.
So that tells me that I kind of start poking around on the right side of the trunk. So we're getting into psoas and iliacus. So when you look at the videos, it's got Brooke Bush, who's incredibly famous. He's really good at marketing, but just showing different techniques for manual therapists, and he talks about how to approach the psoas and iliacus. I'm going to do some similar stuff, and he's very on top of being cautious about how to approach it and that sort of thing. And yes, that is all true. So we can start off by warming things up. You would give me consent, thank you. If we were working on skin, you would roll it around here, but you can still do this through clothes. It's kind of nice, relaxing sensation. I'll be careful with your ring. Obviously, use some nice jewelry. Just be careful of that. So I like to start off by just getting some nice circles, because when you get into these muscles where you have to go through the abs to approach them, you want to get a lot of warmth. You just kind of go right for it. It can be a little abrupt. So some circles to start. I like to roll through here as well. As you can see, I'm mostly using my legs to generate the movement. So using my fingertips on the far end for me, and then the heel of my hand on the closer end to me. Since I want to focus on the right side, the heel of the hand is definitely going to have a little more force than the tips on the far end. You can certainly add a little bit of vibration to start, just to sink in, so that I can start to approach the psoas. So in the video you guys will watch, I'll talk about the semi-lunar lines, which are basically the edge of the rectus abdominis. That's how you approach psoas major. My mentor likes to just call it the edge of the six-pack, because we all have it.
Sounds like me.
And then you can sink in this way. You want to go obliquely, which means you're going to go at an angle. You don't want to go straight down, and you certainly don't want to go kind of sideways, even though that's a little more applicable if the client's prone and it gives you up. But in the case of psoas, you want to come obliquely, and you can sink in the fingertips. That's going to be the most aggressive. Heel of the hands a little less aggressive. Soft fists can also be used, but it's a little too global. So I feel like you lose a little bit of specificity, and I think that is important when dealing with this muscle. So we're gonna go fingertips. Of course, Alicia will say something if I'm going too hardcore, and I will adjust accordingly, because you're the boss. The interesting thing about, like I say, really work on your body position, because it's all about you and your client's the boss. And you find that balance in between the two, so that everybody's taken care of and a good treatment happens. Okay, so we are definitely contacting psoas. Now you'll hit it, because it's going to be like a solid feeling. And I was fascinated in the video, and this is also why I'm not showing it, but I'm going to talk to you guys about it a little bit, because he's like, oh, he pulls the client's shirt up, and I get skin-to-skin contact. It makes it a little easier to contact, and that is true. And then in some of our videos, I think later in the semester, they talk about like, oh, there's like concern about what's it called, stored energy. That stuff doesn't matter. If you're on top of your palpation, the body parts are where the body parts are. I think I even said this earlier in the semester, and I just really want to reiterate it, because stuff that get that crap out of your head. We saw the cadavers. I don't care what your body's shaped like. Your rectus is where your rectus is. Your quads are where your quads are, etc., etc., etc. Let your fingers find it. It's all good. I don't care if someone's You know, I've worked with clients who are like 300 pounds. I've worked with clients who are a lot less. The body parts are what the body parts are. And that's going to help you to approach with non-judgment. You're going to be 100% the healer, the helper, the assistant, and that's what's up. I may find myself saying that throughout the semester, so I really don't want that to exit, because we have to be able to help all clients, all peoples, and just shifting how you bring things in your head really helps with that. It's going to do better work. Okay, how you doing with the pressure? Because I feel like we're slowly sinking in there.
I'm now starting to feel pressure.
Yeah. So I'm adding a little bit of vibration. Sometimes you're having issues finding it. This is what you can do, especially as you get used to finding the body parts. You can have a little bit of knee flexion, and especially if the client has any kind of tension there, which is very common, especially because you guys are sitting in class on how many hours a week, especially you, Alicia. That muscle's going to engage. So that knee flexion is going to make the psoas pop here. It's also going to make the iliacus, because you find the ases and you go medial to the ases, and you kind of hook a little bit and get into those anterior fibers of iliacus. You can feel that there. And then they both attach to the lesser trochanter femur. So how do you find that? You can once again put them in flexion, and you're going to sink down here. And if there is a tight spot, you're going to feel a pop right about here. I think this is great because, you know, obviously I'm relatively close to Alicia's groin, so it's a nice way to kind of like find it without like digging around blind. You don't want to do that. You want to be like, boom, it's right there. You feel it, I feel it. It feels precise, so that's going to facilitate safety because it shows that you know what you're doing. So, and the more you know what you're doing, when people have complicated issues, especially around more sensitive areas, the more they trust you, the more money they throw at you, the more you help them, everybody's happy. All good. So, yeah. So, in the videos, he does not work on the lesser trochanter. I felt like that was a missed opportunity, just why I wanted to just go right to my demo this time. Because you can feel that, right? Yeah, I can feel. I'm like, oof, we're on something special here. Getting that to release is going to be a big help to getting the belly of the muscle to release. The belly and the belly. Okay, enough bad jokes. So, great. If you also want to get more space between like the groin, you can just roll it out once you have initial contact, and now there's a lot of space, right? So I'm like, well, that's what your cancer is right there. Add a little vibration. I can support here, or I can just let it fall down. Let some time pass. Allow the muscle to change tone. Adjust accordingly if you feel like they're not kind of like shrinking, and just kind of chase it down. Which just means move a millimeter this way, a centimeter that way. It's not that, big deal. Cool. So then you can test. So if I put you into flexion again, last time it really bulged and pushed back at me, and now it doesn't. So we've really taken a lot of tension out of that. It's a subtlety, but if we look here, that shift from left to right is a little less. Obviously, if there's a structural scoliosis, it's not going to be perfectly healed. We're trying to minimize, the curvature, and that should increase your comfort level. So I'm going to check the belly again. So this is where I was before. How does that feel versus the first time I contacted it? A little smoother, right? Yeah. So that's psoas. We love that. We're going to check iliacus. I think we could do a little more work on iliacus, so let's do that. So once again, hooking around the ases. So the ases is here. We've got that iliac crest here. And then it's the anterior superior iliac spine. We kind of aim toward it. So psoas, we're aiming this way. Iliacus, we're aiming this way. So a little more oblique and sort of toward me. Arguably, you can do that across the table. You can do that. That's an option. And in that case, you would probably do everything across the table. I haven't accessed the side yet, so I don't want to just go right into it like that. But just showing you that that's a way to do it. moment, I'll show you how to do it across the table. So sinking in here, let's see, and then just checking, right? I'm not feeling it contract, and it's a rotation, which is great, but I do feel like I'm knocking it a little deeper here. Sinking in that. Okay, that feels a little looser to me. And now when I do the flexion, it feels relatively chill. I still feel a little bit of tightness right here. So and that's how you keep retesting. Flex, put in neutral, flex, put in neutral, flex, put in neutral. Now, because I'm me, you can add funky things to it. So you can add a little bit of rotation, and then we can shift the femoral head back in space, which will also further help to line up the psoas and the iliacus. Because when things are tight, then it kind of gets shifted out of alignment, but we want to put things back into alignment. We want the joints to be lined up nicely. It tends to facilitate helping the muscles let go. You're saying, joint, go here, where you're supposed to be. And at the same time, muscle, let go, so that the joint can easily go here. So we're working on both problems at the same time. Putting the joints back in place, releasing the muscles that took the joints out of place in the first place. Instead of just doing one thing. So that was a little challenging for you. So we'll keep contact here. I'm gonna go a little bit slower. I moved it really fast, and then I felt her psoas jump immediately. So that just tells me I have to go a little bit slower to help integrate a different way of maintaining an improved tone.
I actually feel like you want to crack at the side.
I mean, you know, it might happen. So I can do a basic twist, stretch, and if it goes, it goes, and if it doesn't, it doesn't. If you're with a chiropractor, they can do things to make sure it goes. So, okay, something just happened. Good. So now I'm not feeling your psoas poke out when I move your hip around. You're not used to having your hamstring stretch like that. But it can. It can, because the psoas is overactive. It's going to like yank the spine out of alignment when you try to flex the hip. But if you release it, then all of a sudden the femoral head glides back when you flex the hip, and then you can actually get more hip flexion and more stretch in the hamstrings. So that's a cool thing. So joints and muscles. I know, I'm guessing, you can correct me if I'm wrong, most of your education is a lot muscles and fascia, muscles and fascia, muscles and fascia. But if you're not dealing with the joints, it's like an incomplete puzzle. When you're gonna really complete the puzzle. Just stuff you gotta stop me like next week, because I can't do that. So the twisting. You're gonna do a twist. You're gonna hook the foot behind the knee, because that's gonna create a bit of what they call lockout. And then you just twist. And then if it goes, it goes. But, you know, we're not chiropractors, so we're not gonna force that. You can put a little pressure here by the sacrum, bless you, right? And then just reach over and really reach. Obviously, I don't want to contact any breast tissue. I just want to lock out the torso, and then it's like I just using my body weight, right? So that works pretty well. Another variation, if you're really trying to be super careful and nothing wrong with that, you can do it this way. You lose some spin, but it still is a pretty good twist for most people, so that's totally fine. But now I don't have to like kind of reach up and over any breast tissue, so that's pretty cool. Okay, so we try it again. That's a little more open, so we love that. I don't know if you noticed, but this was about as far as she was gonna go, and now it can go a lot further. So if we're doing a full treatment, we'd get into the hamstring. The sits bones are here, and you can just stick into that attachment point right here, and then you can play around with some vibration, or you can just sink it into this kind of compression. You could theoretically use friction. I'd prefer to just sink into the muscle, just a little more focused. And then of course you can add in a bit of dorsiflexion, stretching up the calf, and then you're gonna feel like all the way down the leg, and then do what's called nerve flossing. Have you guys gone over nerve flossing? No? No? Okay. Another time. Maybe another class. But that's pretty cool too. You can do stretches that around a nerve pathway, where you kind of like use the muscles to kind of just pump the nerve, and then as the muscle loosens up, the nerve gets a cleaner signal, and then you have less. It's a great way to like work out, say, sciatica in this case. So you would start quick, because I started it, so I might as well. You would start here, right, to open up the nerve pathway all the way at the distal end, right, and you do that a lot of times until you feel things loosen up. Then you would keep that in dorsiflexion, and then move the knee into and out of extension while maintaining dorsiflexion. You do that a million times. Well, by a million, 30 seconds. Yeah. And then at that point, you would keep the knee in extension, the ankle in dorsiflexion, and then you would move into and out of hip flexion, because now we're following the nerve all the way up to the sacrum. And that would help to loosen up the nerve signal. Probably not a bad thing actually for you, but I'm definitely getting out of like scope of today's class. But I just had to quickly go over the general idea. Maybe one of these days you guys will go deeper and you're like, oh yeah, James talked about that. So cool. So across the table, and I'm gonna actually work a little higher because Alicia's curves are kind of to the left and then to the right here. So I think we're gonna get more bang for our buck by going towards the insertion of the rectus abdominis here, slash the psoas. So rectus attaches way up here, the middle ribs, and of course the xiphoid process. And if we go into the semilunar lines or the edge of the six pack, we can still access psoas through here. So now I'm just doing it across the table to show you guys a different way to do it. You do what's most comfortable for you, because that's what's gonna feel best to the client, because you feel comfortable. Can't say enough. All right, so sinking in here, cross table. So my fingers lightly hook, right? So I'm not doing a super straight line because this is my angle or drive. Now I'm sinking in this way, so I'm kind of scooping down and in toward me. So that's my finger position, the slightest of flexion. So sinking in here. How's the pressure? Good. I'm using a little bit of vibration. If I want to add more pressure, I just squat. Okay, maybe do the most gentle rocking, but this is about as fast as you want to go. So if you go too fast, you've got a lot of structures here, like, the stomach's around here, the spleen's not too far away, you're certainly going through the large intestine, the small intestine's a little more central, so we're definitely going through that as well. So you want to be nice. You want to be nice.
What are you using for a visual landmark for your hand placement on the abdomen when you initially go in? Obviously, you might make small.
Well, that's a great question. I'm totally not using a visual landmark, which is why I was saying all that stuff about different body types. I don't care about the visual landmarks. I think that can actually be distracting. You probably have seen me do a lot of demos where my eyes closed, because I don't care about that. I want my hands to find a way. So, and I beseech you all to really try to like let your fingers find a way. But with that being said, right, so we know what a rectus abdominis is. We know where the obliques are. So that line in between the obliques and the rectus, you're gonna go in between there and then sink. And as you sink, you'll eventually get to the psoas.
The other muscles will part out of the way and allow your fingers to go.
Absolutely. So some of those beginning strokes, I was doing circles and the rolls and all that stuff, just to kind of like make contact and say, hey, we're family, we're here to help. And then that makes it easier to get in. Because you'll find that some clients, so this is doing an amazing job, some clients will tense up, and then you're not gonna get in there. You're not gonna get in there. That's just not gonna work. So, all this worry about clothes or adipose tissue or whatever. No. Somebody flexing, you're not getting in there. That's when it gets hard. So you want to do whatever possible to create relaxation, calm, safety, serenity, and then you just sink in, and you'll eventually get into the psoas. So cool. Spent a little time there. I want to show access to iliacus from across the table. So you've got your as-is here, and you just kind of sink down and through. And once again, if you're doing it blind, you just go at the top of the hip. And it's amazing because people have different leg lengths, so it's really important to kind of palpate that bone. I've tried to guess, and I'm like, where is it? Oh, there it is, and then you go from there. You always feel a bone, doesn't matter what once again the body size is. The as is really super prominent, so very easy to find to palpate. So I'm sinking down here to get into iliacus, and then once again we can still play with that idea of knee flexion, and that makes things pop out more.
Sorry.
You're good. And you can play around with like a little bit of abduction tends to sometimes make it pop more. So sinking in there. And then once again, if you want to find the lesser trochanter, bring it out for safety. It's high up on the femur and medial, so it's going to be right about here. You'll know because you'll feel like it's denser than everywhere else, and pretty high up on the femur, and it's definitely not pectineus. It's just more of like pubic bone attaching to a little lower down on the femur. Not as tight on this side. It's great. So once again, we'll test that out. So that's a little bit of pull here. It feels like it's coming actually from your adductors and your hamstring. So I'm getting a little bit off script here. So I'll come around. If you're feeling skittish about groins, use a soft fist so that your knuckles are the closest thing. And you sink in. And then once you feel confident about what you're working on, then you can shift the fingers at an angle. Notice my fingers are going away from the groin, but into the point of interest. In this case, it feels like brevis's attachment point. Adductor brevis, to be clear. A little bit off track, but we want to create a little bit of evenness, so here we are. Okay, so I'm not feeling the adductors much. We love that. I'm just feeling pure hamstring. So once again, we find the attachment point of the hamstring. We'll do more on that later in the semester, but I'm just creating a little bit of evenness here.
I went to the gym 2 days ago.
See if you see a little tight there. You're doing your deadlifts. Something. Squats, deadlifts, leg press, lunges, step ups.
Just say yes to all.
Or whatever. What's that guy's name? I don't know nothing about this stuff.
You don't like that guy. Talking about your views.
It's gonna be
Do a little Googling.
waking up at 12 a.m.
You got a little twist here. Not so bad. Okay, we have a face girdle lined up. Cool. Love that. Oh, beautiful here. Okay, let's get you on your stomach. How you doing so far? Good.
Looks like you're gonna fall asleep.
And see, and but that's why I'm saying the warm up and the sink in. That you know, and I know I'm like I have a reputation of being aggressive, but it's a sink in. It's a sink in that you do, and you get a lot of relaxation from it. Okay, let's see. So I'm only testing here because any sort of knee flexions may elicit a psoas response. So
She's crunching up.
yeah, exactly, right? And specifically, you can see how there's a little bit of a shift to the left. So what are we going to do about that? We can start off with some stretches. A little twist. So I'm hooking around the as-is, and then I'm stabilizing via the shoulder blade area, mid-back, and can add a little bit of a twist. So some clients are ticklish as hell. This is not gonna work. Oh, are you one of those people?
Mm.
So I think we did run into this. So
Yeah.
if that happens, you go to like the TFL attachment point, so outside of the as is, and you can pull from here. It is harder to do, which is why I always check here first. But you can just kind of sink into TFL, which is great because they may need that work anyhow, and then you just check. But I'm not gonna get as dramatic of a twist. So, since delicious, not ticklish, I'm gonna do it the way I want to do it. You can just hang out here, and if you get really lucky, you may get things to, mobilize. You may have an incident of mobilization, but in the meantime, you can really test to see where things are tight. So I'm not feeling a lot of tension around the actual hip pelvis area, which is great. That means we did some good work. You to me. But there's a lot of tightness up here, and the spinal erector is a bit higher up. So, okay, what do we do? We're gonna sink right into the tightest point. In this case, it's gonna be here on Alicia. So I am going at an angle. I'm going right towards the longissimus because that's the one that sticks out the most, and that's where I'm just feeling the most tightness currently. Client's wearing a bra. Kind of, if you get lucky, there's enough space. You just sink in between and get right into the muscle. Wait for release. Release up here. Love that. Still a little stubborn here. You can actually do a little bit of circular friction, which you don't tend to do, but it's a good opportunity for it. Good. And test again. I'm definitely getting a little more rotation, a little less resistance up here, and now I'm just more of some tightness at this level of the thorax. I'm gonna do the same thing again. Wait for release. Can do a little bit of compression. I'm using quite a fair amount of compression. It's amazing what the human body can handle. So, but I just like lean in nice and gentle. And then things may shift, but because we're going slow, we're still in scope of practice. We like that. And then we test again. And that's what feels I'm open. How you doing?
Good.
So that feels
Feels
great.
like it's loosening up.
Yeah. So, we're gonna do that one more time because I just noticed as I loosen up each area, I'm like, oh, it could go a little lower, go a little. Just follow the erector spinae down. So, good to go there. So now I'm adding that spin while I work in here. So I'm going into the erector spinae. I'm twisting here. The client's ticklish. Because now things have opened up more, I can still get a decent amount of spin by pushing into the TFL. Cool. And then I'll show you guys, it's called the Schroff method, specifically for scoliosis. So we know that it's just a little tight here. So you sink down and you add an angle. So it's I'm kind of rolling and pushing, rolling and pushing. So rolling and pushing. So when we sink in, we just hold that position once we're in place. I like to add vibration, the classic style. There's no vibration, so choose your animal. I like vibration because, as you can see, I'm doing a fair amount of like deep work, but it's just like, right? It's lulling, so I do it. It's literally telling the whole nervous system to just take it down a notch. So it's like, the cannabis technique. About the side effects. So, okay, so checking here. And do the same thing here. So rolling and pushing, rolling and pushing. do that for a while. Wait for things to shift and turn. Look, you take a look. It's not gonna be perfect, but a lot more centralized. You know, it was a definitely significant shift, and now it's like moved over a bit, which tricked out the spine. So that's the deal. I'll show you my favorite stretch. I think I did it to you. I'm sure I certainly did it to Byron. I might have done it to you, but definitely did it to Byron. Let's see what's going on with the rotation here. Beautiful internal rotation, love that. External rotation's a little restricted. So before I do that stretch, I just want to address the hiking of the hip, because the hip is hiked, it's going to affect QL, it's going to affect your obliques, it's going to affect your psoas. I think it's going to come along for a ride. So how do we fix that? You just can literally take a soft fist or a fingertip or a soft palm. I like a soft fist. Kind of, I feel like matches up with a good glute. And I go right above the greater trochanter. And you can do it from more posterior or more lateral. But either way, I get that whole section. I just like drive it down and away. If you want more bang for your buck, you can kind of stabilize the upper body so that it's like you're pinning and then stretching this way. So, yeah. Hang out there for a little bit. How are you doing on pressure? Love that. And you position your body so that just by changing the location of the body, I increase the pressure, but in a way where it's just coming from the ground and into the area that we're acting upon, as opposed to just me doing this, which doesn't feel as good. So, if I want to deepen it, I just drop deep into my lunge. Cool, that's one side. Let's get the other side. Nothing gonna get the other side in this case. She's tighter on the right side. So where am I gonna pin? Where am I the most bang for my buck? Let's go here. But another 10 seconds, then I'll show you best stretch in the universe, and I'll let you guys have at it. Okay, so how do I do that stretch again? You're gonna bring the heel to the butt, and notice not as much cinching, right? It's very minimal. How do I take that up a notch? So there's a few ways to do it. I'll show you the way to do it. You're working with a client who is new to you, and maybe they're naked on the table. You can kind of like slide your knee under like so. You're gonna pin like so. You know, obviously they're draped accordingly, and then you can pull here, but you're gonna push in here. So I'm sending a line inferiorly, but here I'm sending that line superiorly. So I'm creating traction in the ankle, the knee, and the hip, and stretching the quad, psoas, iliacus, all that at once. So that's one way to do it. If you're comfortable, you can pin the client. We still follow the 1 foot on the ground rule. Yay. Once again, they're draped. Now your legs on top of the sheet, right? Because they're draped accordingly to facilitate that. And then you drop down. And you see that I create a lot of traction here. It's a lot more powerful to do it this way. And then I extend the hip, and I'm sure you feel that a lot. Yeah. So, and then if you really stick it up a notch, let's say somebody's like, I love this. Every now and then you get the one, the one masochist that's like, oh my God, just crank it all the way. You can like scoop your arms under it, keep your spine long, keep your butt engaged so that you're sinking into the ground, and you can crank it this way. I don't think you need that. But that's how you would do it if they want more. But traction, extension, flexion. So, and then I roll. If it's a lower back issue, if you had a lower back issue, you roll the hip towards you, and that should take care of any lower back issues. you're stabilizing the pelvis with your thigh. So now you may notice there's no resistance at all, because we've really stretched out the iliopsoas. So, is it here? Scoliosis. I know I usually only work on one side, but you know, scoliosis. I'm not gonna screw around with that. I know. Last one. So I'm gonna go right to it. Scoop, lift, crank. So traction here, knee flexion, roll, pelvis toward me. I want to see the spine look as level as I can possibly make it. Crank. You can actually take a little more here. So let's get it. And then we come out of that. Minimal movement, right? Not a blind man, it's fine. You know, you make nice. Once again, dealing with butts, my finger's always pointing away, right? Or if I'm really feeling extra cautious, you get a higher anxiety client, hey, whatever, jaw drops make safety, always. You know, close the fist. And then just, you know. Thank you.